Hi, I am Dr. Dharma Kumar KG, consultant surgical oncologist at Manipal Hospital, Sarjapur Road. Today I will be briefly discussing about the cancer. What is cancer? Cancer is an abnormal or uncontrolled growth of a cell in a normal human body. What are the different types of cancer and where all cancer occurs? Cancer occurs from anywhere in the body, from head to toe. So broadly we divide cancer into 4 types. One is carcinoma, the second one is sarcoma, where it commonly occurs in bone, muscles. The third one is lymphoma, where lymph glands are mainly affected as lymphoma. The fourth one is leukemia, where cancer occurs in blood. We call it as a blood cancers. So lymphomas and leukemias we call it as non-solid tumors. Carcinomas and sarcomas, we call it as a solid tumors. What are the different types of presentation of cancer, when we should suspect a cancer? There's nothing unique about cancer presentation or nothing specific about the cancer signs and symptoms. The signs and symptoms of cancers are like any other normal disease presentation, like any persistent cough which is not relieved by a regular medication, which is there for almost more than a month, which is associated with sputum or blood in the sputum, is a warning sign for cancer. So like persistent constipation or altered bowel habits in an otherwise healthy individual, especially in a non-vegetarian patient, is alarming sign or symptom of a cancer. We should consult a doctor to evaluate the reason for a cancer. The third is like any painless lump in any part of the body which is not painful, which is there for a short duration of time, like 1 to 2 months, which is alarming symptom for a cancer. Another way of patient present is painless non-healing ulcer anywhere in the body, like it may be in the mouth or in the nipple or in the limbs, is again one of the presentation of a cancer. The other way the patient present, like abnormal bleeding from any part of the body, like it may be from the mouth or during a micturition or during passing a stool, or any abnormal vaginal bleeding in a female, again is a sign, it may be a symptom of a cancer, like any abnormal bleeding after the intercourse or any form of bleeding in between the cycles of a woman, or any bleeding which starts after the stoppage of menopause, is it could be a symptom of a cancer. And there are some vague symptoms where it can occur to any of the cancer patients, like a loss of appetite, or patient doesn't feel like eating, or any abnormal loss of weight which is not explained by your regular food habit or your regular physical activity, which is more than 10% since last 3 months, is again a alarming symptom of a cancer. We should always get evaluated with a specialist oncologist. Then what are the common causes of a cancer? So when it comes to the causes, so approximately 50 to 60% of the time causes are well known. We can predict would be the cause for a particular patient, and another 40 to 50% of the time we will not be able to find out a cause of a cancer. The reason could be some genetic mutation or environmental factors which could lead to a cancer. So 50 to 60% of the cancer which is caused by the known risk factors, like we call it as a modifiable risk factors, which are like most important is the tobacco and its products. It could be in the form of smoking, like BD, a cigarette, or smokeless tobaccos like chewing a pan, gutka, khaini. These kind of tobaccos can cause multiple cancers in the body. And also alcohol consumption is also an important risk factor for some of the cancers. And obesity, overweight, is an important risk factor for cancer in female patients, like for CA breast, and also for ovarian cancer and uterine cancer. So these are the important cancer which can occur due to obesity. And also there are some virus which can also lead to a cancer, like HPSCG virus, which lead to liver cancer, and a human papilloma virus can also lead to cervical cancer. These two viruses are risk factor for a cancer. There are some environmental exposure to the chemicals or industrial exposure. People who work in the industry, they are exposed to some pollution or chemicals which are again a risk factor for a cancer. In some patients, like some people who are exposed to ultraviolet radiation or who constant exposure in the sunlight, especially patients who lives in Australia, New Zealand. So those are the other risk factors for a cancer. If you see, there are some other risk factors where patients are more prone. For the patient who maintains poor personal hygiene are again a risk factor for cervical cancer or penile cancer. Patient who are having multiple sexual partners or starting their sexual activity at the early age. We can say patient who is not married and having a baby at the late age, or not having a baby at all. These are all the risk factor for cancer in especially in female patient. In around approximately 5 to 10% of the patients will have a family history of cancer which runs in the family, especially in a patient those who have two members in a family or more than two members in a family which are affected or diagnosed by a cancer, again is a risk factor of running or getting a cancer in the subsequent family members, especially like breast cancers or ovarian cancer or even colorectal cancer, or what we call as a larger bowel cancer, or even uterine cancer. So these some of the cancers which runs in the family. The incidence is like 5 to 10% general, not more than that. The remaining 40-50% of the time we will not be in a position to find out exact cause for the patient. And also very important is the way we consume food, outside food, junk foods, cold store foods, and red meat, salted consumed spicy food. These are all the some of the risk factors which can lead to a cancer in a patient. So how do we diagnose a cancer? For confirming a diagnosis, we do a simple test called as biopsy, wherein we take a small chunk of tissue and examine the tissue under the microscope to confirm the diagnosis. And also after confirming the diagnosis, we do some scans to know the extent of the cancer, where all it has spread to the adjacent structure or not, or whether it has spread to the other part of the body. So we do CT scan or MRI to know the local extent of the disease, or sometimes we do bone scan to know whether the cancer from one part of the body has spread to the bone or not, or even in some patients we may advise them to go for a PET scan to know where all it has spread. Sometimes for female patients we advise them a mammogram also to know where is the exact location of the lump. So after diagnosing, and we divide the patient into different stages. So there are mainly 4 stages in cancer: stage 1, stage 2, stage 3, and stage 4. Stage 1 and stage 2 are, we call it as early stage cancers, and stage 3, stage 4 we call it as a stage 4 or advanced cancers. Stage 1 cancer is usually located to particular organ in a very small size, in a small extension, and stage 2 is where the size has increased related to the stage 1, or it has spread to the adjacent organs, so adjacent lymph glands, so that we call it as stage 2. In stage 3, the amount of involvement is more in both the where the cancer has raised, or also in the lymph glands. Then we call it as a stage 3. Stage 4 is where the cancer has spread from the primary organ to the distant organs like liver, brain, bone, or lungs. So then we call it as a stage 4 cancer or metastatic cancer, because in a stage 1 and stage 2 cancer the chance of cure is very high, somewhere around 60 to 80% depending upon the stage. In stage 3 cancer the cure rate will be around somewhere around 40 to 50%, and stage 4 cancer chance of cure will be very less, except in few cancers like thyroid cancer, where even in stage 4 cancer cure is very much possible. Even some of the breast cancer can be cured in a stage 4, and colorectal, yes, some of the abdominal cancer in the stage 4, we can still cure them, like colorectal cancers and ovarian cancer and peritoneal surface cancers. These cancers usually present in a stage 4 cancer. We with the recent advancement in surgery and chemotherapies and a lot of newer products, we can certainly give them a very good quality of life, and we can cure these kind of cancers in some of the patients. Okay, what are the treatment options which are available in a patient who are diagnosed with a cancer? So there are multiple treatment options are available for a particular patient, which are usually planned and discussed in a group of doctors, which are involving a medical oncologist, surgical oncologist, and a radiation oncologist, and even a pathologist will also be there, radiologist will be there. So we will plan treatment based on the stage of a particular cancer. We have an option of surgery, chemotherapy, radiotherapy, and the recent advancement in chemotherapy like targeted therapy, immunotherapy, and even a bone marrow transplant for a leukemia patients. So these are the different modalities of treatment we have for a particular patient. So based on the stage, we plan the different modalities of treatment. Say for example, for stage 1 or stage 2 cancer, usually patient requires surgery first, followed by chemotherapy, and also some patients will require a radiotherapy also, depending on the type of the cancer and also the stage of the cancer. For stage 3 cancer, usually we give chemotherapy first, so that the size of the cancer can be reduced, followed by we do the surgery and then complete the remaining cycles of chemotherapy, and some of the patients will also go for a radiotherapy in stage 3 cancer. In stage 4 cancer, mainly the intent of the treatment will be palliative, where because the stage is the cancer is already spread to the multiple organs, where the cure is very, very unlikely. In those cases, we give to prolong the quality of life or to control the disease rather than cure. That is our intent in the stage 4 cancer most of the time. The options available for stage 4 are, like as I said, it's a palliative chemotherapy. Sometimes even the recent advances like targeted therapy and the immunotherapy are also available for stage 4. In very few selected cancers where we can still cure them with the advanced treatment, as I said earlier, like abdominal cancers like colorectal cancer, ovarian cancer, and a peritoneal surface cancer, and some of the thyroid and the breast cancer. With the advancement of treatment, we can completely remove the organs which are involved in the abdomen, like peritonectomy, and what are the organs involved, colon, ovaries, and the spleen. We remove a lot of lymph nodes so that we can give complete clearance, and we give something called as high-pec chemotherapy that is given during the surgery only, so that the chance of cure will be high, and the effect of the chemotherapy will be much better if we give the chemotherapy during the surgery. It has shown very good result in very selected patient. So this is mainly because of the recent advance in cancer treatment which we have developed. This is about the various modalities of treatment options which are available for cancer patients. And when it comes to the prevention and the screening, the prevention is mainly by adopting a very good lifestyle and quitting smoking and having good food habits, and maintaining the regular physical activity. These are the few basic lifestyle modifications we can have to reduce the chance of getting a cancer in a patient, because 30 to 40% of the time we can always decrease the chance of getting a cancer. And the screening methodology which are available for a cancer is mainly 4 to 5 cancers are subjected for a screening, like breast cancer, cervical cancer, and lung cancer, and the oral cavity cancer, and also in some of the colon cancer we can go for a screening methodology. So in female patient for breast cancer, we advise them to do a self breast examination after the age of 25 every monthly, to look for any change in the shape, size, texture, or any nipple discharge, or any lump in the breast or in the armpit. If any changes noted during the monthly examination, patient should visit the doctor as early as possible if any change in the texture or in the size of the breast. After the age of 35, we ask them to visit a doctor every yearly for a clinical breast examination, and after 40 years of age, we advise them to go for an annual screening mammogram so that we can detect the lump even at the early stage where it is clinically not palpable. Even in a very small stage or early stage, we can diagnose a cancer and we can completely cure the cancer at the early stage, especially in a breast cancer. So when it comes to the cervical cancer, as I said earlier, cervical cancer is mainly or mostly caused by the human papilloma virus infection. The best way to prevent to prevent cervical cancer is mainly through a vaccination which is given between the age of 9 to 13 age, especially to the girls. We can certainly reduce the chance of getting a cervical cancer in those girls. So though it is advocated between 9 to 13, some of the guidelines we can also extend up to the age of 26. 3 doses of vaccine can be given. So after the vaccine, even patients those who have not received a vaccine, we always advise them to go for a regular pap smear examination every 3 years starting from 21 year of age. So pap smear is a simple brush test which are done on a OPD basis. We look for any cancer cells which are there in the cervical mucosa, and if any suspicion thing is there, we plan for a DNA testing, HPV DNA testing, or a colposcopy or a biopsy. Based on the testing, we advise them to go for a further treatment. So that is about the cervical cancer screening. Every 3 yearly we do. If the previous 2 pap smear tests are normal, we ask them to go for every 5 yearly. That is about the cervical cancer screening. Next is the oral cavity, especially patient who takes a lot of tobacco, who consumes a lot of tobacco. In those patients, we ask them to go for a annual or once in 6 months oral cavity examination to look for any red patches or white patches or any ulcers which are not healed. So we advise them to go for a regular screening test. And in chronic smokers, those who are smoking 20-25 cigarettes per day since last 15-20 years, we ask them to go for something called as low dose CT scan to diagnose undetected or very small nodule or in early stage for a lung carcinoma. So for colorectal cancers, especially after 40-45 years of age, we ask them to go for a regular colonoscopy screening every 3 yearly or 5 yearly. In patients with the family history of colon cancer, we ask them to go for a early screening in a colonic cancer patient. And also, even in a patient with the breast cancer, we ask them to go for early screening in a family history or patients with the BRCA mutation patients. We ask them to go for a screening at the early age of life. So that is about the prevention and the screening of a cancer. Thank you so much.